Our facilities here also, I would say, outrank most universities, even a lot of large universities.
The facilities placed Slippery Rock above any other grad school that I looked at.
Basically a lab for every classroom.
New. The PT procedures lab with all the new tables and very up-to-date equipment, and the cadaver lab.
State of the art.
Learn anatomy. I put it to use in the cadaver lab.
We have a fairly liberal budget for equipment, for labs.
When you actually see your body and the way it functions and how everything falls into place, it's just, it's like fulfilling.
Anything that pertains to students, we try and get it.
Classes they're hard, but you have the support to get through them.
Everybody's going through the same thing. All 47 of us have the exact same classes, same tests and everything, so we all study together.
Students helping each other, second-year students helping first-year students, faculty helping students, and sometimes the students helping the faculty if that's what it takes.
We actually had a picnic when we first came in, and one of the second-year students at the time adopted me as their little, and they just give you their email. They say, you know, we're here, contact us if you have any questions.
So we expect students to help each other. We do not expect them to compete with each other. We, in fact, discourage that.
It's really nice to have somebody to talk to that's already went through what I'm going to go through.
I have worked elsewhere in the field in academic settings, and I have been here 17 and a half years, and there are many jobs in clinical settings and in academics, and I have made a conscious choice to stay here because I like it and I strongly believe in this program.
I would have to say that the professors are definitely approachable. You can go to them with any questions that you have.
We're very student-oriented, and we like that kind of relationship, one-on-one relationship with our students.
The professors are really friendly, so it's a laid-back class atmosphere. It's not stressful.
As opposed to just teachers, they're more of mentors, I'd say, and they're just trying to give us all the knowledge that they have.
I would say very pro-student, proactive. We all try and stay on top of everything in our field.
That takes constant vigilance, and we need to stay active.
A lot of our professors are actually practicing physical therapists, so they do have a lot of experience in what they're doing.
A lot of our faculty members will invite us down to their clinics, and we get to go in and see how they operate.
Always doing it, whether it's research or clinical practice or whatever it is you're doing, always being active in that, in addition to teaching.
We also do a lot of outcomes assessment to see how our program is, and if our graduates and their employers, if we're meeting the needs of them. We have an 8-semester program that is over a 3-year period of time.
I was surprised about all the work I had to do and all the studying I had to do, especially the first year. It's mainly tests and learning book work and studying all the time.
The first year, the coursework is primarily laying the foundation. It's the basic sciences of physical therapy, so students have coursework like anatomy, pathophysiology. They have neurosciences.
All of our classes, they'll bring in guest lecturers who are specialized in different areas of physical therapy.
They also have PT coursework, procedural courses, like the very basic skill courses.
At the end of the first year of our 3-year program, a student would go to a clinic full-time, work as a student, shadowing somebody for 2 weeks.
Now that I'm in my second year, it's a lot more hands-on and a lot more projects, group work.
The emphasis is on the clinical skills, developing the clinical skills necessary to function in the areas of cardiopulmonary, integumentary, neurological, and musculoskeletal.
Our program actually gives us a great opportunity to do these practical experiences while we're going through classroom activity. So each class has a lab.
In our labs where we practice our skills, they're broken down into smaller groups. That way we can work with our professors closely.
In the middle of their second year, they are out in a clinical experience for 5 weeks. Again, shadowing a licensed therapist and getting a little bit more independent.
And then the third year is dedicated primarily to clinical field work, where the students go out and are working full-time in the clinic.
So 40 hours a week, 15 weeks fall, 15 weeks spring.
We have such a wide variety of placements. It's just not limited to Pennsylvania or Western Pennsylvania. It's all over the U.S.
Clinical field work, where they're working under the direct supervision of a physical therapist. and get a wide variety of experiences to prepare them.
We can use sports medicine, outpatient, something focusing on women's health or wound care, or pediatrics in a home setting, or pediatrics in a school setting. Really a huge variety of sites that we place our students in.
It's really great to hear my clinical instructor say, wow, they really prepare you well at Slippery Rock. That's awesome. That's an awesome feeling. It's so nice. You don't feel scared anymore, and I feel really confident. I love going out into the clinic now. It's just great to actually take all the schooling and everything I've learned and just put it into practice, and that's really